So as doctors, we talk about primary and secondary causes of conditions and diagnoses. Even death has sometimes a primary cause and a secondary cause. So someone might die from pneumonia, but the primary cause, or the secondary primary cause being pneumonia, but the secondary cause being heart failure. All this to say that sometimes when we go through difficult things like traumas and disappointments and loss, can be loss of a future, can be loss of finances, can be loss of a relationship, can be loss of functioning, loss of a limb, loss of quality of life. There is that's the primary cause sometimes of mental conditions, illness, like anxiety, depression, OCD, bipolar, schizophrenia. So there's primary causes, but some of the secondary causes can be the failure to process those traumas. So it can be wearing masks and keeping the pain inside, not speaking, not talking about your pain. As a doctor, if I'm treating a wound, I've got to uncover the wound to make a diagnosis. I've got to diagnose the cause of the wound, and if I don't uncover it, then I can't treat it. Uncovering a wound can sometimes be painful. It's sometimes I have to touch the wound to see if there's pus in, and that's painful. But the purpose is healing. So likewise with emotional symptoms, we don't want to put on makeup unnecessarily. Sometimes it's appropriate not to let it out. Sometimes you just need to keep your thoughts inside to protect others and to function and to continue your work. But there is a time to let it out. There is a time to talk about it, and so you need to seek those contexts, those places, those safe places. If you don't have friends or family that can provide that context, then you can seek professional help to help process your pain, your trauma. And doesn't need to be bad trauma. Doesn't need to be terrible. It can be just the chronic trauma of COVID that you haven't dealt with, or it can be just the chronic stress at work, which provides a sort of low level of chronic trauma, which can cause severe mental health issues.